The first 6 months are very important for the patient to get recovery, especially physical, mental, and emotional. A multidisciplinary program is made, PMR is followed. So, medicines do play a very big part in recovery of a patient post stroke, but the main part that is rehabilitation.
Every 20 seconds, somebody in India suffers a stroke. That is more than 2,000 people every single day. And yet, most of us do not even know what are the warning signs or what to do as they suffer the stroke. Hi everyone, today in this podcast, we are going to make health conversations real, relatable, and relevant. Today's episode dives into a medical emergency that often comes uninvited and unnoticed, and it leaves a lifelong impact if left unnoticed. That is stroke. Today, we are here to talk about two very important things. First, how to prevent a stroke from happening. Secondly, how rehabilitation, yes, rehab, can change the trajectory of recovery. And to help us understand this better, we have with us Dr. Ankit Najara, consultant geriatric medicine, who is working with HCH, Adya 9 hospitals, and Fortitude Daycare, who has helped hundreds of stroke survivors regain their independence at HCH, rehab, and recovery centers. Let's start with the basics. Stroke often feels like something that just happens. So the first question is it really preventable?
Yes, it's preventable. We have to look at a few things. The first is that we keep a regular checkup for our blood pressure. Second, we do not ignore the early signs like slurred speeches, like one-sided weakness. We also have to look at the factors. What is our family history for? And we have to be regular with our health checkups.
Talking about warning signs, what are a few warning signs that people often ignore?
People often ignore warning signs as severe headaches, that could be because of the rising blood pressure, uncontrolled diabetes, that can be as losing a lot of weight and muscle mass, slurred speeches, and weakness at any one side of the body, whether is it right or the left.
And in terms of prevention, what are a few actionable steps, preventive measures that people can start from today?
What are the few preventions that we have to look at? Number one, check your blood pressure regularly. Get your blood test every 6 to 7 months. Visit your family doctor. See your sugar levels. Check your thyroid levels. And always maintain your fitness with physical, mental, and emotional health.
Now let's talk about what happens after a stroke. Many a times, families rush to get medical attention, but once the hospital stay ends, they are left wondering what next?
So what next? It's rehab and recovery. The first 6 months are very important for the patient to get recovery, especially physical, mental, and emotional. So at HCH, we provide physical, emotional, and mental recovery. Neuroplasticity is something that we are very concerned about. We go in for physiotherapy and we go in for rehabilitation. And the first 6 months are the most important for us to get 100% recovery for patients, whether in walking or doing their own household works.
People think stroke recovery is about medicines and rest. Why is rehab just as important as medicines?
So, medicines do play a very big part in recovery of a patient post stroke, but the main part that is rehabilitation and recovery, that is through physiotherapy and other means like cognition, speech, and making a person independent enough to do their own chores of every day and make sure that the person is positive, remains positive on physical, mental, and emotional level. So it is more important than medicines and as important as medicines when it comes to stroke or post-stroke patients.
There's also a misconception that whatever recovery happens in the first month is all you get. Is that true?
So no, it's not 100% true. Whatever recovery you see in the first 4 to 6 weeks can get better with time and can get better with more and more physical, mental, and emotional recovery and rehabilitation that we offer at HCH. A range of recovery from physical levels can be ranged from just going to the washroom yourself to doing your chores and even exercising, from getting emotionally unstable to getting emotionally stable and remaining happy and leading a good stable life. So recovery is not just in the first 4 to 6 weeks, it can go further and a patient can recover 100% also.
Can you walk us through what happens in a rehab program at a center like HCH?
So, at a center like HCH, we try and manage patients who are sick and non-sick. Sick patients who are tracheostomized or on ventilator support or oxygen support can be managed very well in the ICU with our expertise team. The second type of patients are the patients who are not that sick and can be straight away taken to the room and can go in for physical, mental, and emotional rehabilitation. A multidisciplinary program is made, PMR is followed, and we hope and recovery for 100% of the patients for physiologically, mentally, and psychologically.
Thank you, Dr. Ankit, for such an eye-opening conversation. So here is what we learned today. First, stroke is preventable through simple and consistent habits. Secondly, if it does happen, timely and structured approach of rehabilitation can change someone's trajectory of life. If you or someone you know is recovering from a stroke, do not delay rehab. The faster you act, the better is the recovery. To explore expert-led rehabilitation and recovery programs, visit HCH Rehabilitation and Recovery Centers or take expert opinion.